And welcome back. I'm Mabel Jong. This is WHCC TV. Thank you so much for being here with us. And in our studio, our second to the last interview of the day of this 4-day conference. And I'm so pleased to have you with us, Allison De Paoli. Welcome.
Yes, thank you for having me. Pleasure to be here.
Allison, you were a speaker on a couple of panels.
I was yesterday.
Okay.
We talked about how advisors are changing the healthcare landscape for employers and helping them manage their plans with predictability and control rather than the chaos that many of them have right now. And we spoke with other advisors about how to do the same thing.
Okay, and in your work with your company called?
De Paoli Professional Services.
Terrific. What are some of the solutions that you offer to clients?
So we encourage people to think a little bit differently about their healthcare plan. 81% of CFOs think there's nothing they can do about their plan costs, and we know that that's not true. So we give them tools, and the number one tool is look at your numbers. Data doesn't lie. Focus on the people who are spending your claims dollars. If you look at that, you'll see that 6 to 10% of your population is spending probably 90% of your claims dollars. Help those people. Get them access to care. For example, a diabetic person, an uncontrolled diabetic will have $25,000 in claims. An undiagnosed person with diabetes could be 50 or more. Whereas a person that has well-controlled diabetes will cost a fraction of that. So make it easy and accessible and affordable for your employee to get care.
Okay.
And access to care. We all know that 80% of employees have less than $1,000 to cover an unexpected medical expense. If your plan has a $2,500, $3,500, $7,000 deductible, which is not unheard of for a mid-sized employer, your employee isn't getting care, and when they do get care, you have a problem that may be 5, 10, 20 times bigger than something that could have been handled in the physician's office.
Okay.
And then the last big thing we encourage is look to independent firms and look for emerging technologies. Big data can help you manage your plan pretty effectively. Use it.
Okay. Let me ask you, how quickly can a turnaround in terms of costs happen as soon as they work with you?
Well, the lowest hanging fruit, so to speak, is in your prescription spend. I'll give you 2 examples. We recently reviewed a contract with an employer that had $1.25 million in pharmacy spend. We made one change that did not affect any prescriptions. It didn't change the formulary. It didn't add any pre-cert, step therapy, prior authorization. It didn't change where the employees could pick up their prescriptions, and we saved that employer $497,000.
Wow, that is impressive.
Yes, so that's over a year, right? Mm-hmm. But that's immediate. And $497,000 is actually some money.
Yes, it is.
And in another pharmacy contract that we looked at, there was a drug that cost $1.2 million, one drug. We sourced that for $800,000. Now, that's still a lot of money, but it's a third less than the original plan, and their current advisor, which was a large national firm, had no idea that was possible.
Wow, amazing. So those solutions are creative, innovative, and fast.
Yes.
Yeah. All right. Well, thank you so much for your time. We appreciate it.
Thank you. Pleasure to meet you.
Pleasure
Bye-bye.
to see you. And I'm Mabel Jong. Stay tuned. Next up, the CEO of World Congress.